So the next one is from another friend of the organization. Her name is Cheryl Crow. She also goes by Arthritis Life Cheryl. Um, she is going to be giving us some tips on needle phobia. So for those of you who have to get infusions or have to do injections and are not used to it, she has some tips and tricks to help you with that, and also any some arm exercises, shoulder, elbow, and wrist, to help with pain when you are dealing with that with RA or any of the other AI arthritis disease um, diseases. And after we have two of Cheryl's videos, we have two last videos that are both about international things. So we have a stills diagnosis story from one of our volunteers that's located in Brazil. And so that video will be in Portuguese with English subtitles. And then we have, last but not least, advocacy on an international stage with Carrie Kellenberger, otherwise known as My Several Worlds. She was a co-host for us last year when we had our 24-hour live stream, and she's kept up with us ever since, and we have tried to support each other in all of our works. So I am so excited to see those videos as well. And then we will have our quick little wrap up after. And yeah, I can't believe that the raceathon is almost there. We're at our last stretch, our final lap, if you may. And we are going to be heading out of here soon. But first, we have three more segments of very informative and amazing international segments. As you can tell, my brain is shot right now. I'm so sorry, y'all. But we are ready to head to the next video.
Hi there, my name is Cheryl Crow. I've had rheumatoid arthritis for 18 years, and today I'm going to show you how I do my Actemra self-injection. First, I take the medication out of the fridge and let it warm up for about 30 minutes. I also need alcohol pads, a Band-Aid, and some people use a cotton ball, or I just use a roll-up tissue paper. Once the medication has warmed up, I take it out of the container and get the syringe ready and make sure that it's not cloudy and not expired. Looks good. Then I wash my hands. I'm wearing my compression glove right now for pain relief, but I'm going to take it off before I do my injection. Ready to do the injection, I get out my alcohol prep pad. I just make sure to get the area nice and clean. I have a choice between stomach or thigh. I really like to do the thigh. Personally, I find it less painful, but I know other people who find the stomach less painful. So it's really just all about what your own body feels. So I pinch an area where I can feel a good amount of skin and get it nice and wet. And then you don't have to do this. This just gives you a sense of control, but you can let it air dry a bit. Now, I want to mention before I inject the Actemra, or I never know how to pronounce this, tocilizumab. There we go. So Actemra or tocilizumab also comes in an auto-injector pen form, or it comes in an infusion. In general, I actually like infusions because they don't have to be done every week. But in this case, because of the pandemic, I'm avoiding going to the hospital, the doctor's office when I can. So I get the needle ready, and I'm not very afraid of needles, but I am going to give you some tips afterwards about what to do if you have a needle phobia. So I target the area that I already cleaned, and I want to go in at a 45-degree angle. And this one is a little bit bigger or wider than some of my other medications, like the syringes for methotrexate, so it does hurt sometimes. And like I've shown in other videos, instead of pushing down with the thumb, I actually like to push down with the palm of my hand. That just helps because sometimes my thumb joints are tender. And it just kind of helps relieve extra pressure or strain on those. I go a little bit slow on this one. And then I get my little tissue and I put some pressure on the injection site. And it's pretty quick and easy. And then I just put my Band-Aid on. I can barely actually tell right now. I'm crouching so I can get in the view here of the camera, but I can barely even tell where I injected it. You also want to, of course, follow all the instructions given to you by your medical team, but you want to rotate the injection site so you're not doing the same one each time. Here's a couple tips for needle phobia. Now, I personally haven't gone through needle phobia. However, I have gone through exposure therapy for severe claustrophobia and claustrophobia, which is fear of being trapped. That's claustrophobia, and claustrophobia is fear of small spaces. So some of the principles that I learned when going through exposure therapy for my phobia was, first of all, going through exposure therapy with a trained counselor, psychologist, therapist is going to be very helpful for most people. Now you can try it on your own if that's what you're interested in. You have free agency over your life, but having a trained professional can be really helpful because exposure therapy is a bit unintuitive. For me, and I'm just telling you off the top of my head, and kind of from my heart and from my gut, that the most important thing was facing the fear and saying that I can deal with this. I can deal with the thing I'm afraid of, and I don't have to run away from it. So a lot of times for needle phobia, people suggest things like taking a deep breath and doing things to calm yourself down. Interestingly, for my experience of phobia, claustrophobia, I found that those things didn't work for more severe phobia. They worked for mild, like I'm mildly discomfort, I'm on an elevator for like one floor, okay, I'll take a deep breath, that works. But if you're having a more moderate to severe phobia, sometimes the nice sounding therapies don't always work because they actually reinforce this idea that you can't handle it. Like, I can't handle this needle, I need to take a deep breath so that I can handle it. But actually, when you go through exposure therapy, and this is the kind that I went through with my therapist, it was acceptance and commitment therapy, informed exposure therapy. But the idea is that you you expose yourself to what you're afraid of. So if it's a needle, you would, first you could do it in the stair step manner, like just be in the same room as a needle. And then you can work up to, touching a needle. And then obviously the goal for self injections would be ultimately to be able to inject yourself. But the idea is that you just say, I'm uncomfortable and I'm going to sit with this discomfort. And you think, well, why? Like, if you're feeling uncomfortable, why don't you just try to like do something to feel better, right? Like, do a strategy, do a tool to de-escalate. But it's really bizarre. But in this theory of exposure therapy, it's like the only way out is through, and that you again, when you do those things that take you away from what you're like, what they're afraid of, like again the needle, or in my case a small space, or feeling trapped, then you keep reinforcing this idea in your mind that you can't handle those things. So again, the idea is to expose yourself to the thing that you're afraid of and literally just allow yourself to feel the discomfort and then stay with it and not run away from it. Don't distract yourself. Don't try to, look the other way. You actually, and again, this sounds, I'm telling you that this is what worked for me for my phobia. And there's a lot of evidence of exposure therapy for phobias and OCD specifically. So you just allow that discomfort, and over time it has less power over you, because it's kind of like, if you're trying so hard, like let's say with the needle, to not look at it, not think about it, it has a lot of power over you and control over you, versus building up your capacity or your tolerance for being able to say, yeah, I don't like this needle, but I'm going to sit with that feeling of discomfort and that I don't like it, and I'm just going to continue with this behavior that's important to me, which would be injecting yourself, if that's important to you. If you decide that self-injecting is not a goal that you want to be able to do, and that you would like rather have someone else do it, then absolutely go for that. So again, if you are pursuing or interested in pursuing things that will make the experience more comfortable or less painful, there is nothing wrong with doing, an analgesic spray, as long as that's okay with your medical team, or like icing the area beforehand. That could be helpful if the pain is what bothers you. For me personally, I don't find the injections that painful, so I don't do anything really special before them. So again, I'm not trying to like play junior therapist right now. I'm just telling you the frame of reference that really, really helped me, and that you might want to think about. If you've tried the kind of basic strategies like take a deep breath, or calm yourself, or think about a happy place, or get your body, certainly it can be helpful to get your body out of fight or flight, but it also can be useful to teach yourself that you can persevere and you survive despite the discomfort of being in the presence of your phobia. It's like a weirdly empowering thing that at first sounds very out there. Like when my therapist first said that, I was like, this is the meanest therapy I've ever heard of. Like, why? I actually remember asking him, like, how do you do this job? Like, how do you make people go through the discomfort? And he's like, well, because I see that it works. He's like, I've had people come who've had OCD for like 20 years and like not made any progress in their former therapies, and they've never done exposure therapy before. And after a few months of exposure therapy, even though it's uncomfortable at first, their brain eventually like learns that this is like for irrational phobias. These are phobias that it's not actually doing any true like lasting harm to you, like to take your medication, right? In my case, like, yes, obviously there's side effects, but in general, this is not actually threatening me, So it's in the same way that like somebody who like wants to wash their hands 15 times, like it's not going to be threatening their existence to only wash their hands once. So it's helpful to learn that the consequence that you're so afraid of doesn't actually happen. So anyway, that's my 2 cents on that, just because I know it's a frequently asked question. When I started doing injection videos, I literally was just doing them because I thought, oh, it'd be nice for people to have it kind of be normalized and like see someone doing the medication, because it's always kind of like very dry. If you get those hospital produced videos, sometimes you just want to see like a normal person, doing the injection. I didn't really think that people would be maybe feeling really stressed watching it. So I do apologize for not being sensitive to that before, even though I've been through my own therapy for phobias. I didn't remember how many people have a needle phobia. It's a very high percentage. So it's, again, you're not alone. It's not like you're weak or you're wrong for having it, but it is something that you can potentially, grow out of or learn to live with in a more comfortable way. But you have to first be uncomfortable. Again, it's very paradoxical. So that's it. And those of you who see my other videos know that I have lots of life hack videos, lots of personal story videos from the Arthritis Life podcast. So I'm always open for topic suggestions for more videos in the future. Bye.
Medical centers in most cities have outpatient clinics, which means just walk-in clinics you can go to, and the occupational therapist or physical therapist can do an individualized media and YouTube flexion and extension. So if you're going to start wrist hand exercises today, let's start with flexion and extension. So if you're going to start, I want this to be very beginner friendly, and so if you're fatigued from your rheumatic disease, you might find it easier to start off just in the sitting position. So I'm going to demonstrate this using tomato sauce cans, but if you're totally just getting started, you also could use nothing in your hands. You could hold something lighter, or if you're more advanced, you can hold something heavier. So basically, this is an example. It's a shoulder flexion and extension is an example of something that is both a strengthening exercise and a stretching exercise. So you start with these in your lap with your arms in what's called like the neutral-ish position, which is where your wrists are facing inward. And then you slowly stretch up, keeping your elbows in the same plane. So you're not going like scrunching out like this or not going out to the side. You're staying straight. Oops, there we go. I'm a little hypermobile, so it's hard for me sometimes. And then you slowly lower back down. It's really important to slowly go back down for your strengthening, because a lot of times, because gravity helps you, people want to like speed through and just let gravity do the work, like, but actually if you slowly and you do it slowly and more controlled, you're going to actually work those extensor muscles for the shoulder. So that is shoulder flexion and extension. And you'll get various ideas again from a physical or occupational therapist on how many to do. Some will tell you 6 repetitions, some will say 8. So it takes time to kind of figure out your own sweet spot. You do want it to be challenging, but not so challenging that you're excessively in pain or fatigued afterward. So next I'm going to show you shoulder internal and external rotation. What this is in the shoulder joint here, you're going to be going external and then internal rotation. There's actually a lot of different muscles that work on this, and the important thing is you're going to keep your elbow at your side. You're not going to do this. You're going to keep your elbow in the same position, and then it's actually a lot of these muscles in the back help the shoulder as well as some of the ones in the front. So you keep your little cans, if it's cans of soup or weights, in your hand here, and then you can do them together at the same time like this. One of the shoulders is doing external, one's doing internal. And you want to think about keep not letting your shoulders go up. That's one of my biggest issues. It's like what happens when you do exercises a lot is that you have the muscles that you're not trying to target often try to compensate for weakness in the muscles that you're targeting. So the upper trapezius, which is one that's really tight for me, it's like, I can help, let's do that. But you're like, no, I'm trying to work these muscles around the scapula that are your shoulder blade that help with internal and external rotation. And this is something, again, you can do without any weights, any resistance, as like more of a stretch, or with resistance as more of a strengthening exercise. And again, the amount of repetitions is really going to depend on your own level of fitness and strengthening. And basically what I say is any movement is better than no movement as long as it's not causing you additional pain or fatigue. So that is shoulder internal and external rotation. The next example exercise is simple old bicep curls. So in this one, the backs of your hands or the knuckle parts are in your lap, and then you simply keeping your elbows at your sides. You slowly bring your little cans up, so where your hands are kind of touching, going towards your shoulders, and then slowly bring them back down. So it's actually elbow flexion, that's the bicep, but then also extension, that's the muscles, the triceps on the side of the upper arm. You can do this as many times as you want. Most people's biceps are stronger than their triceps, so you might feel those triceps fatiguing quicker than your biceps. The next one I want to show you is wrist extension and wrist flexion. So if you sit with your palms in front of you, wrist flexion goes like this, and wrist extension is like this. So you can, with some weights as resistance, these are actually probably a little too big because I'm kind of having to change my angle to just keep my grip on this. But just to show you an example, you want to feel when you're flexing, you feel these muscles working on this part of your forearm, and when you're extending, you feel these muscles working. There's a ton of muscles, tiny little muscles that are in your forearm that actually many of them cross the wrist joints and go into the hand and help control your fingers as well. So again, this might be something that might be contraindicated if you have carpal tunnel syndrome or wrist fusions. I mean, there's, like I said earlier, there's caveats for everything. This is definitely not a replacement for an individualized exercise program from a licensed, occupational therapist or physical therapist, but it's a demonstration of something that I, for example, as a patient of rheumatoid arthritis for 20 years, that's appropriate for me. And it's something that, again, it's a stretch if you do it without any resistance. It's technically a little bit of a strengthening without resistance just because you have gravity. But you also you can do this if you're like taking a little break from sitting at the desk for a long period of time, or you could use some resistance and do it as more of a strengthening exercise.